Welcome to this tutorial on the Professionalism Assessment Rating Scale, or PARS. This presentation is broken down into different chapters to make the download faster and to make it easier to look at the content as you move through this. So, what is PARS? It measures two of the 6 medical core competencies, specifically interpersonal and communication skills, and some aspects of professionalism. And it does this by looking at 2 main domains. The first one is the relationship quality. That is the relationship that the medical student or physician or nurse or physician assistant has with the patient. This looks at specifically rapport. What kind of rapport do they have with each other? Empathy, the ability of the clinician to instill confidence in their work, and also the quality of nonverbal communication. It also looks at the examination and treatment quality, which includes eliciting information, active listening, informing, educating, and counseling the patient as appropriate, and conducting a careful, thorough physical examination or treatment as required. Ordinarily, trained standardized patients learn to rate with PARS by first learning the PARS instrument and all the behavioral anchors that go with it, and by observing a set of videos. And we usually do this in a group, and the standardized patient come up, garner their ratings together. We discuss them and iron out any differences and misunderstandings about how to use the rating scale itself. So, and this requires ongoing training. We do this approximately every 3 months, and it's an ongoing process of quality assurance. The rating scale is broken down into a 1 to 9 scale, ranging from lower quality 1 to 3 and higher quality 7 to 9. I should say that the rating of number 1 and number 9 is very rare. It doesn't happen much. If we got consistent ratings in the 1 to 2 range with a student, we would really have to take measures to remediate them, especially if it happened over the course of time. Likewise, ratings of 8 or 9 are rare in medical students. There are always ways when we look at their work that they can improve their work. So this is pretty, the 1 to 2 range and the 8 to 9 range are pretty rare for standardized patients, to give that to medical students. I think of the rating system as almost like a theater with 3 rows and 3 seats per row. There's the lower quality row, 1, 2, 3, higher quality row, 7, 8, and 9, and the mid-level section with seats 4, 5, and 6. And the lower quality ratings are generally observed by people who are less experienced. Could be you might have a lot of experience but simply having a bad day. All we're doing is evaluating a moment in time. We're not making any generalizations about the quality of their work. Unless you have a lot of ratings, you really can't do that. It could also be, again, a very experienced clinician who's working with a difficult patient who throws them a curveball, which sometimes happens, especially in certain situations, or it could be unprofessional behavior observed by the rater on the part of the physician or the student. And on the higher end, in general, more experienced clinicians communicate better with patients. We do see in training, though, over the course of 4 years, students tend to get better, their skills drop off, and then they improve again over the course of time. But it could be you could also be an experienced professional who is able to function well in spite of having a bad day. That's really one of the marks of professionalism, is rising to the occasion. And also the ability to deal with difficult patients with poise and a great deal of competence. And the mid-level scores really are a combination of both lower quality and higher quality performance. I would refer to the full PARS guide for all of the behavioral anchors to understand exactly what it is we're evaluating, but this will give you some idea of what the guide looks like and what the trained raters look for when doing their evaluations. There's some rating rules that we use. One is you want to make sure that each item is rated separately. There are 8 items to rate. Each one of those should be rated separately, and they could be different. You want to rate the most consistent behaviors of the student or the learner. You don't want to be bothered by a single bad event that kind of clouds your judgment. You want to look at what's the most consistent behaviors. So sometimes students will start slow and get better over the course of a few minutes. Also, you want to rate on merits, and this is extremely important. We urge the standardized patients to not reward students because they seem to be trying hard but are really incompetent or less competent, and also to avoid the halo effect, which can go both ways. In other words, just because someone does one thing well doesn't mean they do everything well. Especially this comes about when the student is attractive, articulate, and intelligent. It sometimes clouds the judgment of the raters on what exactly they're looking at, and it goes the other way too. The halo effect also refers to some characteristics of the learner that the rater does not like, and suddenly everything becomes bad and they miss the forest for the trees, so to speak. We give in the PARS holistic ratings. That is, we want to look at overall communication and clinical professionalism quality. So that's really the aim of the rating scale, is to give an overall view of how they're performing under simulated conditions.